The reason why COVID-19 vaccine has come around so quickly is because a lot of money and resources have been thrown out. These are the steps normally taken to create a safe working vaccine. It usually takes at least a decade to complete them all, but with COVID-19, they've all been done in less the year. So as is the case with all medicine, vaccine goes through extensive and rigorous testing before it can be approved and rolled out to the country's population. Before any testing happens in humans, the vaccine is tested on animals in a laboratory. In the case of COVID-19, vertebrates, mice, and monkeys have all been used. That's because they're similar to humans in their physiology and biology. If the vaccine works and is safe for animals, clinical trial began. Phase 1 trial involved giving the vaccine to a small number to health folders between 20 and 50 people here there looking at safety to check in generates an immune response and to determine the correct dosage. Phase 2 trial involved several hundred volunteers and look at how effective a vaccine is in humans. This group involves adults of all ages and sex. It ideally all in human disease group involve adults of all ages and sex, ideally all ethnicities. Phase 3 trial are similar to phase 2, but they involve several thousand folders. They're still looking at how effective the vaccine is, but at a much broader scale. Usually, these clinical trials run one vaccine after another with the time given for data on how safe, effective, and stable the vaccine. And then to make a decision about whether the trial should progress to the next stage. But because of the seriousness of the COVID-19 pandemic, these phases sometimes overlap. Somewhere even mirrored, but all the checks that would normally happen was still being done. Countries have been so keen to find solutions that money has been thrown at generations to recruit more scientists to work around the clock and to hire more staff to help find folders more quickly. And because COVID-19 has been so widespread, finding folders to the test the vaccine on has been easier than in other year. Cheers! When enough data has been gathered, is submitted to a country's regulator for a powerful scientific and clinical expert review it to see how effective the vaccine is, how safe it is, how stable its quality, and check that it's being manufactured and stored in a way that meets safety standard and public health policy. In the UK, this is the job of the emperor, the commissions, human medicines, and even members of the public are asked what they think. Normally this happens. After all, the trial have ended, but in case of COVID-19, the UK's regulatory body was being given data as the trial went along. This is called a rolling review. Is vaccine is then approved, it can be given to a wider population, but regulation keep monitoring health in records and data on anyone who gets the same as for any vaccine or medicine, and even bits of the vaccine that is made is checked purity and quickly before it sends.